The NHS is struggling to cope with the demand for healthcare services due to the pandemic, staff shortages, and budget cuts. In this section, we will explore how these factors are affecting the quality and safety of care for patients and staff. The pandemic has put unprecedented pressure on the NHS, with more patients being admitted to hospital with COVID-19 than at the previous peak in April. The NHS is also facing the challenge of delivering the largest and most ambitious vaccine campaign in its history, while developing services for patients with long COVID. These demands have forced the NHS to scale back or postpone care for non-COVID conditions, resulting in longer waiting times and a growing backlog of treatments. As of December 2021, there were 162,000 patients waiting more than 52 weeks for elective care, and the overall standard of 18 weeks was not met. The impact of COVID-19 on mental health and well-being has also been substantial, with an estimated 10 million people requiring new or additional mental health support. Staff shortages have been a chronic problem in the NHS for years, driven by inadequate workforce planning, insufficient funding and infrastructure for training, and poor retention of staff. The pandemic has exacerbated these issues, as staff have faced increased workload, stress, burnout, and risk of infection. Staff absence due to COVID-19 or self-isolation has reduced the capacity of the NHS to care for patients with or without the virus. The latest figures show that there are 110,000 vacancies across NHS England, including 39,652 nurses and 8,158 doctors. This means that 1 in 10 nursing posts and 1 in 17 doctors' posts are unfilled. Staff groups have warned that the shortage of frontline personnel will affect the quality and safety of care, as well as the ability to tackle the treatment backlog and deliver the vaccination program. Budget cuts have also contributed to the challenges facing the NHS. Since 2010, public health budgets have been reduced by £1 billion in real terms, affecting services such as health visiting, sexual health, and drug and alcohol treatment. These cuts have undermined the prevention and early intervention of ill health, especially among deprived and ethnic minority communities that have been disproportionately affected by COVID. The pandemic has exposed wide and persistent inequalities in health that require a comprehensive program of action if leveling up is to be more than an empty slogan. Social care has also been neglected by successive governments, with no sustainable reform or long-term funding plan in sight. The lack of integration and coordination between health and social care has resulted in fragmented and inefficient care for patients, especially older people and those with complex needs. In summary, the NHS is facing a perfect storm of challenges that threaten its ability to provide high-quality and safe care for patients and staff. The pandemic has added to the existing pressures of staff shortages and budget cuts, creating a vicious cycle of unmet demand, delayed care, and overstretched resources. The NHS needs an ambitious and long-term response from the government that addresses not only the immediate crisis, but also the underlying causes of its problems. This includes investing in workforce planning and training, increasing public health and social care funding, tackling health inequalities, and integrating health and social care services. How private GPs are offering faster and more convenient access to consultations, prescriptions, and referrals for a fee. Private GPs are doctors who work outside the National Health Service, NHS, and charge a fee for their services. They are not regulated by the NHS and can set their own prices and standards of care. Private GPs offer a range of benefits to patients who are frustrated with the NHS, such as faster access to appointments. Private GPs usually have shorter waiting times than NHS GPs, and some offer same-day or next-day appointments. Patients can also book online or over the phone, and choose a time and location that suits them. Longer consultations. Private GPs typically spend more time with each patient than NHS GPs, who have an average consultation time of 10 minutes. Private GPs can offer up to 30 minutes or more per consultation, allowing them to address more complex or multiple health issues. More convenient prescriptions. Private GPs can prescribe medication on the spot, without the need for a separate visit to a pharmacy. Some private GPs also offer home delivery or online ordering of prescriptions, saving patients time and hassle. Easier referrals. Private GPs can refer patients to specialists or other services within their network, without the need for approval from the NHS. This can speed up the diagnosis and treatment of certain conditions and give patients more choice and control over their care. Additional services. Private GPs can offer services that are not available or limited on the NHS, such as travel vaccinations, health screening, sexual health testing, cosmetic treatments, acupuncture, and more. Private GPs charge a fee for each consultation, which can vary depending on the length, location, and type of service. The average cost of a private GP consultation in the UK is £70, but some can charge up to £250 or more. Patients also have to pay for any prescriptions, tests, or referrals that are not covered by their private health insurance or the NHS. Private GPs are not a replacement for the NHS, but rather an alternative option for patients who want faster and more convenient access to primary care. There are an estimated 2,000 to 3,000 private GPs practicing in the UK, and they can be found in various settings such as hospitals, clinics, gyms, or even online. Patients can use websites such as goprivate.com or Nuffield Health to find a private GP near them and book an appointment.